So I'm really trying to look at the clinical evaluation for a patient with acute kidney injury. Now, for the clinical evaluation, when we're talking about clinical, that's like you being on site. So being on site, like you are in the hospital, a patient came with an issue of acute kidney injury. So you are trying to look at what could be the possible things I'll see on this patient, so that they can be able to help me confirm that this patient actually has an acute kidney injury issue. So for what we have, we said that evaluating a patient with acute kidney injury requires a structured and thorough approach. Do you understand? So first of all, you have to get some information from the patient, and this information is pushing you to now try to tailor the question and say that this patient actually has issues with their kidneys. You understand? Then after getting the information from the patient, you still go to see things for yourself. This way you do physical examination. After the physical examination, you are collecting some samples from the body to now do some tests and further confirm for things. Do you understand? So for getting the information from the patient, it's just all around history taking. Now for the history taking, things you should actually be you ask so many things, the patient will tell you so many things. Do you understand? But make sure that these things that will be highlighted here should be captured in whatever you and the patient are talking about. Okay, so when did the issue start? Okay, you talk about their urine. How is their urine? Is it little? Is there no urine? Is it normal urine? Is there proteins in urine? How was the color of the urine? Is there pain when they urinate? Their main problem is a kidney issue, right? So try to ask all the questions around the kidney. They also ask them about infections and all of that. Try to know the type of drugs they have been taking lately. Try to know if they have been exposed to toxins. Try to know if they have any other disease conditions, that is going side by side with these kidney issues. Try to know if they have ever been sick before that has made them undergo a surgery. Then maybe if they have been exposed to radiology. So if they have been exposed to radiology, now you can ask them that before they did a radiograph, did they give them anything? Do you understand? That's a contrast. Then you try to also know about the family history. So family history, you are trying to look at, has anybody in the family actually had these issues? So physical examination. So physical examination, you are just trying to look at, blood pressure, heart rate, temperatures. You are trying to take all the vitals. So you are looking for signs of dehydration, or maybe signs of overload, depending on the issue that the patient is facing. So signs of overload, of course, the body of the patient should be swollen up. Then you look at the skin, what is on the skin that can make you to be able to suspect a particular thing. Then do they have any issues related to the nervous system? Do they have any issues related to the abdominal? That's the abdomen. Then you now take some samples, send it to the lab. Then from the lab results, you are looking out for things like serum creatinine. This to know how the kidneys are still filtering the waste product creatinine out. Then you are looking at the electrolytes balance. You are looking at the complete blood count. Then you do urinalysis. That's the urine itself. So for urine itself, you are looking for any abnormalities in the urine, proteins, blood, specific gravities, urine electrolytes, blood gas analysis. Do you understand? So you also do imaging, where you are trying to take a picture of the kidneys so that you can structurally look at it. Of course, imaging shouldn't be able to dictate a physiological issue, right? This one you are looking at the anatomy. Is the anatomy still the anatomy of the kidney, or are there some issues here and there? So this is a classification which we have already spoken about. So but if you want to look at the classification, you can pause to look at it. So this one is just classifying acute kidney injuries depending on the site. So the injury could be before the kidneys, that's in the blood vessels bringing blood to the kidney. Okay, sometimes the issue is within the kidney itself. Sometimes the issue is after urine has been formed in the kidney, so this urine to be put out of the body. That's where you have those issues coming in. So that's it for the clinical evaluation of a patient with AKI.